How often does Hodgkin lymphoma recurrence happen? Have you ever wondered how often Hodgkin lymphoma comes back after treatment? This is an important question for many patients and their families. Understanding the recurrence rates can help in planning for the future. Research shows that about 20 to 30% of patients with Hodgkin lymphoma experience a recurrence, also known as a relapse, after their initial treatment. The likelihood of relapse varies depending on the stage of the disease at diagnosis. For patients with advanced stage Hodgkin lymphoma, the risk of relapse can be as high as 30%. In contrast, those diagnosed with limited stage disease have a lower risk, ranging from 5 to 10%. Most relapses tend to occur within the first 2 years following treatment. After this period, the risk of recurrence decreases significantly. This is encouraging news for many survivors, as it suggests that the longer someone remains in remission, the less likely they are to experience a relapse. Hodgkin lymphoma is generally considered highly curable, especially in its early stages. Standard therapies can lead to remission for the majority of patients. However, it is important to note that about 1/4 of patients may either relapse or have disease that does not respond to initial treatment. For those who do experience a relapse, there are still options available. Salvage therapies, which may include high-dose chemotherapy and autologous stem cell transplantation, can offer a chance for a cure. However, the success rates for these treatments tend to be lower compared to initial therapies. Long-term monitoring is crucial for survivors. Although the risk of relapse decreases after 2 years, long-term survivors may face increased risks of late complications. These can include secondary cancers and cardiovascular diseases, which can impact overall survival. In summary, roughly 20 to 30% of patients with Hodgkin lymphoma may experience a relapse. The risk is higher in advanced stages, and most relapses occur within 2 years of treatment. After this time, the risk decreases significantly. While salvage therapies can be effective, they are generally less successful than initial treatments. It is essential for survivors to have ongoing follow-up care to manage risks and support long-term health. Always consult with healthcare professionals for personalized medical advice and care.